this day, Challenge Day, it reminds us of the challenges that we face in responding to those who are affected in our community, responding to providing awareness about HIV and AIDS in Southland District, in Western Province. We face a lot of challenges.
Anything that is an obstacle to whatever activities we are performing to reduce or at least bring the rates for wellness down, those things must be overcome. Those things must be addressed so that all our activities, all our way forward, whatever we want to do to address reduction of HIV/AIDS in our country must be deployed, must be addressed, must be prioritized and pushed forward.
We celebrate this day to honor the people who have lost their lives to HIV and AIDS, who have left their families behind, their wives, their children, their loved ones. But we are also celebrating the lives that we have saved for people that are living with HIV and AIDS. Many people on Daru Island that are living with HIV and AIDS, they are facing what we call stigma. Stigma means when someone has HIV, all of us run away from them. We don't look after them. We put them outside of the house to sleep in the house cook until they become very sick and almost dying, and we bring them to the hospital. Those are the people that face a lot of stigma. Those are the ones that we must respect, we must honor, we must love. Even though they have the disease, we have medicines for them. They can live the rest of their lives because we have these medicines available for them. For the young ones that are walking around, for the fathers, the mothers, the young ones, the ones working, the ones not working, if you have not tested for HIV and AIDS, make sure you come to Himara Kigiro Clinic and get yourself tested for HIV. HIV does not happen to you now. When you contract the disease HIV, you will not see the symptoms now. You will see the symptoms 10 years later, and then it's already too late. In the last 10 years, you would have spread it to everyone that you've become involved with. So every single person on Daru Island must come to the clinic and get yourself tested. Whether you're a married man, a married woman, or a man who is not married, all of you must come for testing. And let me remind you, if you want to engage in a sexual activity with someone other than your wife or your husband, think of HIV. Because HIV on Daru Island is very, very high. So let me give to you your Daru numbers. Since 2011, we have registered more than 200 people at the Himara Kigiro Clinic. But right now, as I speak, only 90 of them are coming to the clinic and getting their medicines. The rest, we don't know where they are. They are not on treatment. Some may have died already. Others are not on treatment. They are spreading the infection. And most of those people, they are not old people. They are young ones like you and me in school, active, playing sports, doing all these activities. So before you touch a man or a woman that is not your wife or your husband, please think of HIV. Or if you have done so, come for testing. And also mothers that are pregnant, please come to the antenatal clinic and get tested if you want to save your baby from getting HIV. Imagine a child born and is got HIV from the infected mother. The child, for the rest of the child's life, will be on medicine. Many children would have died at birth or before birth because of HIV. So every single mother, a woman who is about to get pregnant or is planning to get pregnant this year or next year, when you do get pregnant, please come and get tested at the antenatal clinic so that you will save the child, not you. You will save the child from becoming infected with HIV. And this is very, very important, that every single mother must come for testing at the antenatal clinic. So we have a big problem on Daru Island. More than half of our patients are not coming back for treatment. and they are walking and living amongst us. And they are the ones that are easy to sleep with, both men and women. Every person that you talk to, you must ask them, have you checked your status for HIV? For this year, 2025, everyone sitting here walking on the road, driving in the car, if you have not tested yourself for HIV, you must come and check yourself for HIV. Don't get scared. HIV is a good test. When you get tested, you will know that you are negative and you remain negative. If you are tested positive, we have a good news for you. We have medicines to treat you. And that medicine is lifelong, but it will save your life. It has saved many lives. So make sure you come for testing and know your status. And I'm glad to see little children around here, very innocent. But if the father or the mother gets HIV and dies, these children are going to suffer. They will have no one to run to. They will have no one to pay school fees. So parents, be responsible as a father and a mother. Get yourself tested. If you are negative, stay negative. Passing lo Igris lo man, na Mary lo nar lo man, stop him. And this la passing that's all. HIV go people lo country style. Before you text another man, another woman that is not your wife or your husband, you must think past them. And Mary blue, I'm no man blue. Because eventually that text message is going to go into sexual activities. And that's how HIV is spread. HIV not spread on the street. It spreads in the house and goes onto the street. So make sure we do these things correctly. As a father and a mother, husband and a wife, be faithful. If you cannot be faithful, what are you going to do? Always use a condom.